Welcome back to OMFS Essentials. In our last episode, we covered the steps for achieving surgical access, managing bone, and performing an odontectomy. We now move to the critical final phase of the procedure, preparing the wound for closure and initiating post-operative care. This phase dictates the quality of healing and the patient's post-surgical comfort. The key mantra after extraction is see, feel, and freshen, then close. 1. Wound debridement and preparation. Once the tooth is removed, the socket must be meticulously cleaned and prepared for primary closure. A. See and feel. 1. Initial hemostasis. Pack the socket to achieve initial control of bleeding. 2. Inspect for foreign bodies. Thoroughly inspect and palpate the wound for loose bony fragments, devoid of periosteal attachment, tooth fragments, granulation tissue, or any residual cystic lining. These are all foreign bodies that will impede healing and must be curetted and removed. B. Freshen. 1. Bone smoothing. Palpate the alveolar bone margins. Any sharp bony margins must be filed off with a bone file and made smooth. Sharp edges cause local irritation and inflammation of the flap, which interferes with healing. 2. Flap trimming. Lacerated margins of the flap must be carefully trimmed. Tissue with compromised blood supply will necrose, leading to dehiscence. 3. Gingival cuff. If the tooth was partially erupted, the gingival margin surrounding it often has a reduplicated epithelial edge, gingival cuff. This margin must be excised and freshened up because epithelium to epithelium contact prevents healing. 2. Suturing technique. The purpose of suturing is not to achieve a watertight seal, but to approximate the tissues to allow for primary intention healing. A. Suture material and placement. Material. Typically 3/2O silk or absorbable Vicryl is used. First suture. The first and most critical suture is placed at the distal end of the second molar. This ensures proper closure in the interdental area. Dehiscence here is common and leads to persistent distal pocket formation and recurrent periodontal problems with the adjacent second molar. Tension. Sutures should be placed loosely. Placing sutures too tightly results in 1. Strangulation and avascular necrosis of the wound edges, leading to dehiscence. 2. Preventing decompression, which leads to excessive inflammatory edema. Knot placement. Sutures should be equidistant and the knots should be placed on one side, away from the incision line. 3. Postoperative care. Successful surgery is incomplete without proper postoperative management to minimize complications and control discomfort. A. Immediate management. Gauze pack. Instruct the patient to bite firmly on a folded gauze pack for 30 to 45 minutes to ensure clot formation and hemostasis. Ice or cold compression. Application of cold packs to the external cheek immediately following surgery is vital to minimize swelling and edema. B. Medications. Analgesics. Pain control is paramount. NSAIDs are typically the first line, often combined with a narcotic for breakthrough pain. Antibiotics. Continue the prescribed prophylactic antibiotics for the recommended course to prevent post-surgical infection. C. Patient instructions. Activity. Limit strenuous activity for the first 24 to 48 hours. Oral hygiene. 1. Do not rinse or spit for the first 24 hours. This dislodges the blood clot and can cause a painful complication known as alveolar osteitis, or dry socket. 2. After 24 hours, gentle warm saline rinses should be started to keep the area clean. 3. Diet. Soft, cool foods should be consumed initially, avoiding straws, which can create negative pressure and dislodge the clot. 4. Suture removal. Timing. Sutures are typically removed on the 7th postoperative day, or earlier if non-absorbable silk is used. Summary. The final stages of third molar surgery are defined by meticulous attention to detail. Debridement, remove all foreign bodies and smooth, sharp bone. Suturing, place sutures loosely to approximate tissues, starting with the critical suture at the distal of the second molar. Post-operative care, focus on cold compression to control swelling and strict adherence to hygiene rules, no rinsing for 24 hours to prevent dry socket. A clean wound bed, proper closure, and effective pain and swelling control are the keys to reducing patient morbidity and ensuring a rapid return to function. You've been listening to OMFS Essentials. As always, keep mastering the essentials.